This is Dan Morrill, Director of Client Services at Dynamis, and this is intended to give you an overview of the changes in our December 19th, 2014 release. So there's four main changes to be aware of. The first is going to be showing and hiding plan groups is an enhancement that should really help out from a presentation standpoint on being able to hide plan groups without deleting them. We also have added sticky enrollment for community ratings so that it allows you to maintain your mapped enrollment counts for each plan, even if you have to re-import your upload template. We've also added a new Aetna format, their 2015 conversion for the new format of Aetna that's available in the carrier conversion sheet, which is downloadable from the plan designer. And then lastly, we've updated our healthcare reform report with updated 2015 values to reflect the change in the affordability test percentage and also the number of exempt employees that was provided in transitional relief by the Treasury Department earlier this year. So those are the four enhancements. You will now see the individual videos that are available in the knowledge base from the dynamiscorp.com website, and the videos will go into more detail on each one of these enhancements. Thank you. All right, we're going to walk through now how to show and hide your plan groups. So here's our sample employer. You'll notice we have three proposed plan groups that we have here. So maybe in walking through with the employer, we come across our first proposed plan group and we decide this is one that we're not going to consider right now. So since it's a plan group function, we're going to focus on the plan group header as a navigational guide. And in our option box, right on our plan group header, you'll notice there's a hide button. I'm going to go ahead and hide that plan group. So we can hide the plan group right from the plan group header option box right here. Now, we also have a master control that allows us to show and hide all the plan groups at once. And that's found in the control box, the option box in the upper right hand corner. And you'll notice there's an option now that says show hide plan groups. So when we bring that up, now we have a master list that we can check which ones we want illustrated. So from here, maybe we're going to eliminate this proposed option and just focus on the first insurance. As soon as I save that now, we have those options hidden and we're down to the one that we're considering. Now, once we've hidden those plan groups, you'll notice when we go into the presentation mode that they're gone. And if we come over, we can see that those plan groups have actually been hidden. This will also impact when you do your plan group comparison report, which plan groups are accessible in the menu. Now, one note on working with community-rated plan groups. You should still use your coverage period setup to hide your renewal and renewal at budget plan groups as part of your normal community rating process. But you would use these controls to access your proposed options. So showing and hiding plan groups, now a feature in the plan designer. This video will explain the sticky enrollment function in community rated plans in Dynamis. So here's a sample proposed community rated plan group with a dual option. So the key is if we look at our enrollment, we'll see that we have specific people enrolled in specific plans. And if we click on our enrollments and take a look at our enrollment counts, you'll notice we have these enrollments mapped, each person to a particular plan. So now let's say we need to re-import for whatever reason. Let's say we're adding a couple of more plan options and loading some more premiums, and we've updated our Dynamis upload and we want to re-import. So I'm going to go to coverage period setup, to our census, and go to re-import. All right, so we're going to replace this census with our upload sheet. So what happens now is we come to our validation screen. Those are the right plan designs. So now we're going to go in. And you'll notice now that even though I re-imported, I still have maintained my enrollment counts. So prior to our update, those would have reset to 0, and every time you had to go make a change to add another plan, you'd have to go into every plan group and reassign your enrollment. So this will be a big improvement, hopefully save you a lot of time when you have to add additional plans or make changes to your upload template. So sticky enrollment, you can convert over and re-upload a template and still maintain your mapped enrollments. This illustrates a sample Aetna 2015 format for what their age tables and their proposals and quotes look like. So you'll see that this format is different than our generic Excel. They have the ages and tobacco, non-tobacco on a listed as rows on here. So this does not work into our generic rate table, but we have a new format now that will allow that. So as far as the carrier template, you'll notice now our most recent carrier conversion template available for download in the Plan Designer now has a Aetna rate table. Now the format is called Aetna Ohio. That's because this is specifically designed based off an Aetna Ohio exhibit, but there are other Aetna plans in other states that are using that same rate table format. So as long as it is Aetna and it is in that same format that we just illustrated, then we'll be able to operate with it even if it's Aetna in a different state. So same rules apply. We're going to copy the whole age band, and now when we go into our conversion template, we're going to go and right click right under the age, and I always paste special and just put the values. Okay, so there, that's in, ready to go, and ready to be converted over into premiums like the other formats. So that represents Aetna 2015 format, specific to Ohio, but applicable to other Aetna areas. And as always, with any questions, support@dynamuscorp.com. Thank you. We have made an update to our healthcare reform plan analysis report. Values are now updated to reflect changes for 2015. So a couple of quick things. You'll see that the new cost of increase has taken the affordability testing from 9.5% to 9.56% as a safe harbor. So that's been updated, as well as the number of exempt employees. So this was previously set to 30, but to reflect the change provided by the transitional relief issued by the Treasury Department last year, for 2015, we will be using 80 exempt employees. So in this case, we have an employer where we have 90. They would not be subject to any kind of a penalty since they don't meet the 100 full-time employee benchmark. So at 100 employees or more, we would take out the 80 exempt and calculate the penalty based on that. So again, these changes are to update those plan design healthcare reform analysis report with 2015 values.